welcome to Leaders of Tomorrow, India's only daily enabling platform for small businesses. Over the past 7 years, we've understood what matters most to you, the entrepreneur. And in year 8, we're taking head-on 2 of your most pressing concerns, that are funding and mentoring. I'm Sunanda Jayaseelan. We're doing a very crucial panel discussion tonight, talking about the area of mental health and mental awareness for you, the entrepreneur, what you should know, what you should do for your employees, and also what is needed if the ecosystem around us needs to change. I've got some very interesting experts in studio with us today. Let me very briefly introduce them. First up, I want to introduce Amrita Tripathi. She's Head News Partnerships at Twitter India. She's also in her personal capacity running the healthcollective.com. Manoj Chandran, CEO of White Swan. Rohul Banshali, co-founder of GoZoop. Lakshmi Srinivasan, co-founder, Petali. Manoj, Amrita, Rohan, Lakshmi, thank you so much for coming down to our studios to talk about something which is very, very crucial in today's day and age. Unfortunately, though, we feel that the information available as to what needs to be done more by organizations, by entrepreneurs, by companies is not enough when it comes to mental health and mental health awareness. So I'm very excited to have each of you experts in studio today talking about what small businesses should keep in mind when it comes to mental health and mental awareness, particularly given that we have the World Mental Health Day, and a lot of organizations want to do something, but what? Perhaps we'll try and break it down in this panel discussion. Let me start first off with some figures. And as journalists, we love quoting figures. So let me talk about what the WHO has said. It's estimated that anxiety and depression and mental health has cost the world economy $1 trillion annually when it comes to lost productivity. This is for each of you on this panel. I want to start this panel by talking about, one is, it is good to do and you need to do when it comes to mental health and mental health awareness, but there is also an economic cost when it comes to not engaging enough perhaps with your employees. And that is something that we need to look at, and this is open to all of you.
I think we look at sometimes the barriers of entry to a conversation when it comes to mental health and mental illness. And certainly even before I joined Twitter, when I was reporting on the subject, I realized that for a lot of people, they don't realize that we all actually have mental health, right? This is something that several experts have told me. We're all the best guardians of our own mental health. So when you expand that to include companies, to include entrepreneurs, I think we realize how powerful it is when we're able to work with stakeholders and sort of quote unquote normalize that conversation, because we're doing a huge service then to people to equip them with the vocabulary they need, but also allow them to know where they can get help if they need help, allow people to understand what are some of the signs and symptoms to struggle with. So I think a key takeaway for me has been, as we're seeing the mainstreaming of these mental health and mental illness conversations in India, we're at that kind of inflection point where it's a great time for companies and entrepreneurs to also get involved, because credible, compelling knowledge is there. We know certainly on Twitter there's a very vibrant mental health community, if we can call it that, which is a great place for shared learning, for discussing lived experience, but also getting access to experts and organizations.
In workplace particularly, what we have seen is that, like you pointed out about the good to have, we soon see that we will be into a must-have kind of scenarios. Increasing trend of mental health issues at workplace, and WHO and World Economic Forum have begun to speak about them, these issues. So it's important we understand that mental health should not be seen in the same lens as any other health issues that we have handled, even at workplace or other communities actually. So what is that we could do differently for us to handle mental health and look at it in a more non-clinical space for solutions? And that is something which is important. And for us to be able to do that, first thing for us to do is to pick up the right knowledge.
Sure. So we will come and talk about what companies and entrepreneurs should be doing, but let me come to this side of the panel. I just want you to address the data that we have, which is very startling.
Yes, I mean, as you mentioned, 1 trillion is what the loss in productivity. Let me just quote you one more data point here. In fact, it is WHO study also says that if $1 is invested in mental wellness of an individual or of an employee, the returns is $2.32. And that's a huge investment, return on investment that you could get. Having said that, if you look at Indian employee or Indian corporate organization for that matter, 42% of Indian employees are depressed. Now, if you're looking at that and the returns, which means leaders today need to really look at this particular data point and make sure there are enough policies around mental wellness in the HR space or in the organization space.
Sure. What would you want to add to that, Rohan?
Yeah, I mean, of course, these are some terrific stats, but what's come to my mind is, just as an entrepreneur, right? I mean, beyond these stats too, there's a certain responsibility we just have as sort of, humans towards each other. We started having conversation amongst our leaders in office. The first thing we did is we got a counselor on board, who was not just a HR team, but someone who was completely, of course, neutral, to just have an outlet to talk to.
Sure.
But that was just a starting point for us, right? Then we realized that the main shift that we have seen beyond the data is just if we could build a more compassionate organization. Of course, that leads to lesser attrition rate,
Sure.
Better efficiencies, better team bonding, and XYZ.
Sure.
And speaking to counselors such as Lakshmi, we realized that sometimes they just need a time off. So what we instituted is a 9-day paid leave if you're going through a mental wellness issue, and there's no permissions needed for this. You can just, it's pre-approved. So that's what we instated.
Sure. Let me come to you, Manoj. I understand you have 3 pillars, so to speak, that you sort of look at and work on when it comes to mental health and awareness. Very briefly, run us through.
The first step to understanding workplace mental health is that there are 2 sides to it, and we usually we miss that part. One is that what do we do for people with mental health issues who are at our workplace, and secondly, how is the workplace becoming a trigger for mental health issues? They're 2 different things.
Sure.
We don't understand that usually. So, and there are clear steps to be taken for each of them. And to make sure that we are accommodative for people who have mental health issues, and making sure that our workplace as an environment is free of triggers for mental health issues. When we understand, begin to take preventive steps, we've taken the right steps in the right direction, I would say.
Sure. Amrita, I also want to discuss the October Allies campaign that you run at Twitter. What can you tell our viewers about that?
Sure. Actually, that's a White Swan Foundation campaign that Twitter wanted to collaborate with, because it's an 8-week campaign. And, in the media and also otherwise, I think we love these tentpole days. So it was running from Suicide Prevention Day in September all the way through World Mental Health Day. And the idea of the October Allies campaign is not just for White Swan Foundation to share information that we all need access to about mental health, but also have a call to action, which is, I pledge to be an ally. So just coming back to that earlier point about the most important thing I think any one of us as individuals can do is really equip ourselves with the best possible knowledge about mental health and learn what are the myths and facts. We thought it was really important for Twitter to collaborate on this, to bring a little, sort of surface the discoverability of that conversation. Not only are we a platform which exists to serve the public conversation, but we realize these are nuanced issues and you need to collaborate with stakeholders across the spectrum.
Sure. Okay. Very briefly then, Lakshmi, if I can also ask you to talk about Betterly and why you really felt drawn to this cause.
So let me talk about Betterly, and then I'll tell you what's the purpose and why I started this. So Betterly is a mobile platform which helps to improve employee performance by making social, emotional and behavioral coaching accessible to them. So one of the major things that we realized was there is lack of knowledge for sure, but we as a startup do not have that kind of capacity to be able to go and create awareness. And so we said, why not be the service providers for people who really need it? So we created the mobile platform which gives you access to qualified scientific methodologies of counseling and coaching available to you on your mobile on the go. And that's how we, of course, collaborate with GoZoop as well. Why I was drawn to it? Of course, everybody has a personal journey, and specifically when it comes to mental health. So I come from a dysfunctional family where I was exposed to sexual and physical molestation over a long period of time. And I also lost my sister in 2016, and which made me realize that me being psychologist, although my sister had access to somebody who is close to her, but she could not come up and share all these things. But only while in the last days, while she was passing away, she started talking about all her depression and anxiety issues, and which triggered totally, and I said that if I couldn't make that difference to her, what about people who do not have access to it at all? And so I started working and researching on creating a mobile platform, the Betterly mobile platform, where how could we have a platform available to people who can be totally anonymous because of the stigma that we have culturally, anonymous platform where people can talk, share, and also have a community of people who can just be there to listen to people who really need this kind of support.
Sure. Okay. I'm going to pick up on that and talk about 3 different sort of pillars or stakeholders really in the ecosystem. One is leaders and what leaders should be doing. The second is what should companies be doing. And the third is what should employees themselves be doing.
What we have learned in White Swan, because we have been putting together huge amount of knowledge, and we have learned that there are 3 broad pillars at workplace that we have to handle from a knowledge dissemination point of view on mental health care. First is to assimilate employees. Employees across the board must have the right knowledge to begin with to say, what is my role there? What does mental health look like for me? Second most important one here is the middle management layer must be educated and trained on many aspects of mental health care. Many a time you'll find that the first detection of mental health care issues could possibly happen at the middle management level because they interact with employees a lot. And if there is a problem that comes up, then they could look at it and then they begin to say that I should be playing a very positive role here. And what is that role they should play? Like we were discussing, listening skill, for instance. How do I listen to my employee, my staff member who has possibly a problem? Third is what we have to look at is transformative actually, is the role of a leader. And which is the most important peg in this entire thing because leaders have the strongest role to play here. And they don't have to really understand what is the clinical service and all. Two things they have to understand. One is that how do I create an environment where everybody can speak up and seek support? And there is zero stigma that we are creating then, at workplace. Secondly, they must champion. They must walk the talk. It's very, because mental health in general is a very difficult subject. Unless I see my role models speaking about it, opening up, I wouldn't want to open up at all.
Okay. I'm going to take a very quick break on that note. Much more on the other side. Just stay tuned. Welcome back with us here on Leaders of Tomorrow. And tonight on The Crux, we are talking the crux of the matter when it comes to mental health and mental awareness for you, the entrepreneur. Middle management most crucial because you're closest to the employees and therefore being able to listen. Any sort of training you would recommend for
So they should go through this training actually because one is there is a whole lot of unlearning that must happen before they begin to pick up a whole new paradigm on mental health care. I need to remove my notions and beliefs. And that must happen for them. And this training that we are suggesting must probably be given to everybody actually at the middle management level.
I think you can look to individuals, who have shared their story. We have, Tanmoy is a journalist. He goes by Toy Mango. He has a Twitter thread that's been running for 2 years now, I think, on what it's like to live with depression and anxiety. So they don't sugarcoat, they're very real stories, and people can draw support, solace, and sort of validation sometimes I think is important, but also knowing, like you said, that someone is there who's gone through what I'm going through. I can reach out to them, even if, suppose an SME doesn't have the funding to put in an entire helpline in place or something. There are resources available. I think that's the best shared learning.
No, I think, as I shared as an entrepreneur, I think I look at it as my responsibility, like towards my team, to sort of create that space, as Manoj said, of open sharing, and what we can do as leaders to sort of reduce the stigma. And one of the things we've done at GoZoop is we've gone more grassroots, where we're just speaking more about compassion. So we've seen these sort of shifts, but also as just beyond organization, I think just as humans, just the aspect of compassion, of listening. And while listening, right, at least that happened to me, I would always say, this person is sharing, so I need to give a solution. But sometimes there's a lot of value in just listening, because the talking itself is the healing. And I think, just that's something we can sort of put knowledge into action.
That businesses need to have in-house counselors, therapists, etc. Is that crucial, particularly given the target audience that we're talking to?
I would look at it this way, I think it just cannot be having a counselor on board. The initiative that the organization needs to take should have a three-pronged approach. One is about creating awareness. A lot of people do not understand what mental health is. So there has to be initiative around creating awareness, creating a narrative which is more consumable. People don't understand what mental health is. So creating the narrative, that's awareness. The second is to be able to create initiatives around prevention. Okay, it's not only about people who are suffering or having depression and anxiety need support, but there is a whole lot of people who do not have clinical depression and anxiety diagnosed, but people like you and me, every single individual, and as we say, 1 in every 3 people are depressed in India, which means one of us here is depressed, and we need to create prevention. And the third prong approach should be on empowerment, and that's where I take the point, as you mentioned. How do we create we call it as emotional aid for managers? Can we have those emotional aid programs for individuals, especially team managers, who are the first point of contact for their employees and team members? So if all organizations can look at these three-prong approach, I think,
We saw 500,000 tweets almost. from India, and 4 billion impressions. People are looking for this information. People want to talk about it. I think it's about how do you eradicate that barrier, which we might feel come in sneaks in because of stigma or perceived stigma.
Most companies have a great HR team, but there are conflicting roles because that's the general sort of consensus that you speak to HR. But there's also a thought of confidentiality. Is that going to go to my top management? What? And that's where a sort of in-house counselor, who's neutral to the entire aspect comes in.
I just want to come back to something that Amrita was saying, and you're saying, opening up of conversations. You at Twitter are in, a unique position in the sense that a lot of people increasingly are saying they're being bullied online, and that perhaps is creating thoughts of anxiety, depression, etc. And on the other hand, platforms like yours are powerful when it comes to normalizing conversations around mental health. How do you really see this playing?
I think, to be honest with you, I think everyone at the company feels that safety and health and creating that safe space is of paramount importance. And going forward, certainly you're going to see that there are measures also in place to make sure it's a more robust ecosystem. No one should feel unsafe sharing, but there are challenges that come in, Manoj, I think when you come to sort of curating online spaces. And partly it's all of us also equipping ourselves with that knowledge and knowing how to be empathetic. I think that's a human trait that we should take online.
Since we are talking about good to do and must to do, I also want to talk about what perhaps you're doing in India, which is very different from what is happening globally. Any sort of global best practices that you think entrepreneurs in India should be looking at?
No, so, something we all talk about, I think work-life balance is an important aspect to bring to this conversation. But I was having this conversation with Mr. Kavi Ratne, he's ex-chairman of Unilever, fantastic guy. And he spoke about work-life me balance, where he says, life generally, especially in a city like, a metro like Bombay, where life is like your family and paying your bills and doing all your societal, all those responsibilities. But what about your me times? And one shift that we've started making or trying to make at GoZoop is to look at it not as work-life balance, but work-life me balance.
I do want to talk about the fact that the issues that we're talking about, right? The solutions that we're talking about when it comes to mental health, etc. Would you say that the same perhaps would apply to a business which is not necessarily based in a metro? If you're based in a tier 3 or a tier 4, would the solutions, challenges, etc. that you have as an organization perhaps be same? What do you do differently, if anything at all?
We have seen a huge number of people coming from smaller towns and seeking knowledge on mental health care. Clearly, there is a huge need for information, which means that problems exist. And secondly, there may not necessarily be service providers available to them so that they could go to them, which is why their first port of call is to seek the knowledge and understand what should I do. There is enough understanding to probably to begin with saying that I have a problem or we have somebody who has a problem and I need help. They may not necessarily put a tag like depression or anxiety to that. They don't even know that what it is, but they need knowledge. They want to know what do I do with this problem, and which is a great first step actually.
I want to talk about the role of the government when it comes to mental health. The government has, of course, for the first time recognized mental health and the mental health policy, but clearly there is much more that needs to be done.
Indian government only spends 0.6% on mental wellness in India. For every 70,000 people who need mental health, there's only one psychologist or mental health professional available. That's the dearth of, that's a lack of mental health professional that we have in India. And I'm going to touch upon the cost aspect of it as well. So there are two ways of looking at it. Are we looking at the cost of giving accessibility to of mental health to our employees? That's one way. The other way of looking at it is that if you provide a mental health access to an employee, what's the return that you get on it? That's one. Having said that, there are platforms available which are extremely cost effective even for a small-time entrepreneur or a small-time startup to be able to give access to their employees as well. So it's not only about the cost, but it's also about creating that access and creating that avenue and the culture also in the organization. So, so there are, even from the government perspective, I think if we can create more mental health professionals and qualifications so that we have more and more people taking the mental health expert role per se in the country as well. So that's the two things that I would like to share.
90% of an entrepreneur's sort of entrepreneurial journey revolves around where's the money coming from.
True.
For professionals, entrepreneurs who are who are running organizations like yours, businesses like yours, which are in the mental health space, easy or difficult to raise funding?
Oh, absolutely. I mean, I would say it was extremely difficult for us to raise funds, especially because we are totally niche. In India, of course, mental health, everybody's stigmatized, and And funding is all about equity returns. And obviously, an organization which is in a business which is so niche and stigmatized, how do we put the money on it, or how do we take the bet on them?
Rohan, my question to you is to really understand, you being one of the first companies to have a policy like this.
Right.
My question to you is, where did that idea thought come about? Why did how did you prepare for it? Why did you feel the need for that?
We realized that the importance of not only the leaves is one aspect of it, and that's a more reactive aspect. If someone is going through a mental wellness issue, what do you do to support that reactively? But what can we also do proactively? And we've noticed that in terms of just numbers, of course, you have a better organization, but that has so many ripple effects on your business in terms of attrition rate, in terms of efficiency, in terms of just people feeling belonged to the organization.
Sure. Amrita, we've been talking about good to do and must do. And I just want to tweak that and talk to you from, the perspective of being the largest social media platform. If you have any advice for entrepreneurs who are watching this, what would you have to say?
I mean, I think they should look at the fact that, like we said, there's so many of these conversations happening. You have such great CXOs, CEOs, business leaders on the platform. It really is one of the biggest shared learning exercises if you think about all the conversations happening in real time in the public. Look to folks like, Harsh Mariwala, obviously Deepika's foundation is doing some great work. I call White Swan Foundation. You have a lot of these lessons playing out in real time. And I will just take one point from what Lakshmi said. And I think in a personal capacity, seeing what I've seen over the last couple of years on reporting on mental health, there are many independent outfits who are willing to more than meet you halfway if you're coming with an issue that needs to be addressed. If you're willing to sort of address issues of mental health in your organization, you'll find a lot of independent outfits.
Okay, I just want you to, in fact, talk about the Health Collective.
Oh, I would love to, yes. So my personal capacity, so basically I was a health reporter a long time ago. And about 3 years ago, actually, and this is a story that was triggered off of Twitter. Somebody had tweeted that their friend was in Mumbai. I saw this 2 days later, and I DM'd just to be like, I'm sure you found some help by now. And I was actually quite shocked and appalled that he hadn't. And this is sort of upper middle class privileged Mumbaikar. So I immediately set up the site. Basically, we started with thinking we'll just have listings for resources and helplines because I already had that from an earlier avatar. And then we've grown since then because I think every time we've featured a story of someone dealing with a sort of lived experience, more and more people will write in and say that made a difference. I want to share my story, or I feel I can take solace. So we're constantly in this space of trying to use storytelling as an important narrative to expand the conversation. And like I said, we don't love the word normalize, but really mainstream and normalize these conversations because that's the biggest, I think, gift we can give.
Sure. Manoj, I'm going to let you have the last word. You're doing great work at the White Swan Foundation. My question to you is what perhaps you would like to see changing urgently when it comes to the ecosystem? We were talking about the government, we're talking about companies, etc. But the larger ecosystem itself.
The biggest battle that we are fighting in mental health care is denial. We are always into this cocoon saying that there isn't a problem in my organization or in my family or within me. Unless we remove that, you're not going to win this battle at all. So it's important that leaders, particularly entrepreneurs, I know of many entrepreneurs who are in denial of the problems that they might be facing themselves. They must accept that there is a problem and seek support immediately.
Manoj, Amrita, Rohan, Lakshmi, thank you very much for your time with us here on the show. We've run completely out of time, but if you have any feedback for us or you want to connect with any of the experts here in studio, do get in touch with us. Our contact details coming up on your screens in just a moment. Thanks for watching. Have a good night.